chiropractor with Upper Cervical Cervical Health Centers, excuse me. Dr. Scott Baker is originally from Davenport, Iowa. He attended Sherman College of Chiropractic and specializes in upper cervical care. Dr. Baker attended Scott Community College in Bettendorf, Bettendorf, Iowa, where he received his Associate of Arts degree, and then he went on to get his bachelor's degree from Ambrose University, majoring in biology. He completed his doctorate studies at Sherman College of Chiropractic, and while attending there, Dr. Baker was awarded the rare and prestigious Service Distinction Award. Please welcome Dr. Scott Baker.
Well, I sure hope rain doesn't wipe away your intelligence, because I got nailed on the way here. I'm an avid motorcycle rider, and I've actually been blamed. The first time I've ever bought a bike brand new, I always bought used bikes. I've had a used bike all my life, and for my birthday, I decided I wanted to buy a brand new bike, so I got like half a mile on it. But since the day I bought it, it's been nonstop rain, so it's my fault. You're all wondering what's been going on the last 8 weeks. It's all because of me. At least that's what Dr. Thomas told me. It's my fault. So I appreciate you having me here, and I apologize for the distraction of being wet. But let's get down to it. I'll tell you a couple things. One of the first things I want to talk to you about is probably a really important question. Because a lot of people know kind of what chiropractors do for the most part. Most of you probably don't know what Upper Cervical Chiropractic is, which is an advanced branch of chiropractic, where you get an idea we're going to be manipulating the bones and trying to free up nerve pressure. That's the gist of it. But isn't a better question, why do I do what I do? Would you want to know that? I mean, you're going to put your health in my care, in my hands, and people don't ever ask, why do you do what you do? And I think that's an important question. I always ask that question. I want to know what someone's why is, because their what is not near as important as their why. And why I do what I do is because I believe that God made your bodies, and that He made your bodies to be self-healing organisms, as long as there's no interference. And that's a very important distinction. You can't put a Band-Aid on a dead guy, can you? It doesn't work. As long as you're alive, you can heal, and your body can heal, as long as there's no interference, depending on what level of interference. So I'll tell you a little bit about upper cervical. We focus primarily on the top two bones of the neck that surround the inferior brainstem. The inferior brainstem runs every function pretty much in your body. It runs all the stuff you don't have to think about. That's probably the easiest way to explain it. When we think about moving around and then looking after lunch, right? That's about the extent of our thought process. But in your body, you've got 75 trillion cells, give or take a trillion, right? That do about 200,000 processes per second. Who's running that? Are you thinking about respiration right now? Are you processing homeostasis in your body? Are you growing nails, growing hair? Do you think about that? Are you looking at me right now and taking all the pixels and turning it upside down and figuring out, oh, it's a guy talking right there? You're not thinking of those things, right? But something is running that. In our philosophy of what we call innate intelligence. Innate intelligence is nothing more than the power that animates the entire universe. It runs every function and everything in the world, not only within your body, but also in the planet, the universe all around you. There's definitely something distinct there. As a Christian, I call that, God is obviously in charge of that. Whatever you put into place, somehow it works, right? Because if not, we all just kind of fail in where we are. So as upper cervical doctors, we find that the inferior brainstem, the top part of the neck, is an extremely important part. Matter of fact, it's so important that God made the first bone, which is called C1, the cervical one. That's the first bone to harden in your body. Did you know that? It hardens before your skull does. That's a pretty important thing. So if you just look at nature, look at the way things work, then that's kind of how we approach stuff. We always feel that the power, the feels comes from the inside out. And that's how we look at things. So if there's any pressure on the inferior brainstem, as you can understand, would disrupt communication between your brain and your body parts, wouldn't it? So let's say I had a hose right here with water flowing here, and I went over and stepped on the hose. Okay, and the water's flowing this direction. Is there anything I can do to the rest of the hose to make the water flow faster? Could I get surgery? What about a pill? Can I put a pill in it? What about cut it up in a couple pieces? Inject something in it? I just gotta take my foot off it, right? And the water starts flowing. And that's pretty much the same thing here. Sadly enough, subluxations in the top vertebra are as common as cavities, and they're very subtle. And they'll happen over years. It's very simple. Let me do something here. Yeah, you'll work with me here, won't you? Yeah. Put your hand up for me. Okay? Can you hold this paper clip for me? You got that, right? That's not too heavy for you, right? Can you hold it for a minute? How about an hour? A month? A day? You know, even something light like this, if you take away from the center of her gravity, anything that comes away from the center of the gravity, over time wears it out. Have you guys ever asked yourself the question, why is it when someone, as they get older, they always have one hip replaced? Last time I checked, we were going with both hips the same day, right? Did the warranty go out on one first? You know, you take a person who weighs about 200 pounds, you set them on a scale here, you set them on a scale there. If they're leaning due to a subluxation of the neck, even millimeters, can cause you to have a short right leg or a short left leg. You can lean from one side or the other. So if you had a 200-pound person, they weigh 100 pounds in each scale. If they're subluxated, they're leaning to one side. Let's say they weigh 140 on this scale and 60 on this scale. Let's take a bet. Which one do you guys think is going to go up first? The heavy one, right? But it happens over time. It happens subtly. And people don't really recognize that until sometimes it's too late. A lot of times people come to chiropractors because they're in pain. I mean, that's really what people call it. I have low back pain, I have this and that. They don't even know why they have pain. They just want you to pop it and make you feel better. A lot of people don't realize that a lot of the pain you're experiencing is because you're out of balance. Inside your brain, you got a thing called a righting reflex. You guys ever heard of that before? Well, when the cervicals go out of balance, it takes your head off from the horizon. If it's off from the horizon, then what do you think your body's going to do? It's going to react to that. It's not going to like it. It's going to want to fix it. Do you guys know when you can heal? What time? When does your body heal? Awesome. Good educated crowd. I love it. That's true. The only time you can heal is when you're sleeping. Now you can get a cut, right, and it's going to coagulate as you get a little scab there, but that doesn't heal. That's just an emergency mechanism that happens. At night, your body heals. So this reflex will tell the brain, we have subluxation. We're on level with the horizon. We need to fix that. Okay? And so what will happen is the brain will tell the muscles, because the muscles hold bones, start pulling on it. Now, if it does its job in the morning, you'll wake up, and the muscle's got that bone back where it belongs. You wake up, you brush your teeth, you go on with the day. But if not, you'll wake up and your neck will be sore, your shoulders will be sore, your back will be sore, everything will be sore, and you get up out of bed, and what's everybody say? I must have what? That's right, I slept wrong. There's no wrong sleeping. You didn't sleep wrong. Your muscles are fatigued because they're constantly trying to fix something. But here, let me tell you a little secret. So when you get up, you stand up, you're subluxated, you're to the side, you're out of balance, you're out of center from where you're supposed to be, your body's hurting. Why is it within an hour or so you start feeling better? Then you go off to work, you can work all day long, but as soon as you come home and sit down, it's like, oh, it all starts to hurt again. Your body and your brain are highly intelligent. We're not collecting berries and hunting deer with spears anymore, right? But we have to work to survive. The main purpose of the brain is adaptation to its environment and survival, right? And so what it does is it'll release chemicals that deaden the nerve throughout the day. So therefore you can function and provide groceries for the body because the body wants to eat and survive. But as soon as you get home, there's no purpose for that anymore. It's time to turn the signal back on. And so that's where your signal is. It's telling you, hey, something's wrong. Did you know one of the number one signals that we get for an upper cervical subluxation or pressure on the brainstem? It's anxiety and depression. It's not a psychological response, it's a physical response. That's why the patient's always describing this, something's wrong. I can't tell what it is, but I can feel it happening. I can actually physically feel something. But if you sit there now, let me ask you this, would any of you allow me to get in your car tonight and take a piece of black tape and put it over your oil light? Any takers? You just wait till the car starts knocking and then we'll know something's wrong? It's not a good idea, right? And the same thing, your body's constantly giving you messages, stimulation, you know, it's out of pain, it's symptomatology, whatever it is. The point is those signals need to be heard, not turned off, okay? Now there are certain chronic cases, and we can argue more and more and more about other things, but the majority, 99% of the time, it's a pretty simple answer. You know, something is out of balance, something's not working properly, and I have cases all the time that are just amazing. So I'm just going to share a couple things with you of some of the things that we work with, okay? I do get, of course, the back pain that comes all the time, but what's really cool, we just finished a 6-year research project with 750 multiple sclerosis patients that were all trauma-induced MS, which means they had some sort of trauma or accident which caused the lesion either on the spine or some of them are actually up around paraventricular area of the brain, which is inner brain, is what we're looking at. The lesions are like, they're almost like a scab, is what the best way to, or a scar inside brain tissue. As we did this study, we found that within 2 to 4 weeks, and 98% of the patients were symptom-free. Now, that's not that's cool in its own right, but what's weird about MS has a tendency to come and go, right? So a couple weeks really isn't a good indicator. So we went ahead and worked with these patients for 2 years, and we did post-MRIs every 6 months. And the most amazing thing about it is when we took pressure off the brainstem, the body was about to heal itself. The lesions disappeared from the MRI. Symptomatology never came back. So, if that being said, due to Merck guidelines, we're the only ones that actually have an answer for the trauma-induced MS right now. We also did a piggyback study of tubular artery insufficiency, which is what causes strokes, and the same type of results we had with that as well. I mean, you never know what you're going to deal with. I don't heal anything. I just want to be clear about that. What I do is I look for the most specific way that your bones can be moved. Everybody has different bones. This is why this type of chiropractic, which you guys have all seen, this kind of stuff right here, that stuff does not work. Maybe for a young guy who's just fixated, or a young female athlete or something like that, that stuff seems to work pretty well for helping them feel better. But how you feel doesn't really make a difference. Because, you know, there's only a third of the nerves up here in the inferior brainstem have pain receptors. 2/3 don't. So people walk around like this all the time. Right? They don't know. You don't really know what's going on, so it's best just to check it. Of course, you know, when it comes to the hierarchy of stuff, you can go, 30 days without food? I think I can make 3 days, but they say 30 days without food, right? And then you have like a week without water, maybe, and then, you know, a couple minutes without oxygen. But how long can you guys last without nerve energy? 0, right? So it's a pretty important thing. And when you're seeing people that come in with cancers, neurological problems, neuropathy. I had a guy just today came into our office 3 weeks ago. He came in a wheelchair. He's 31-year-old male, was told that he had MS. Very rare for a man to have MS. That's just weird, okay, in its own right. But they told me he had MS. He complained, his initial complaints were nerve numbness through here and through here. Went to a neurologist to get checked. She did some x-rays and an MRI. Actually did 7 MRIs, found some sort of P-like thing between right around the middle of his neck, and then said, hey, we think you got MS, we're going to put you on some MS drugs. Within 48 hours of being on the MS drugs, he was paralyzed from his belly button down. And it's been that way for a year, and he just got married a week before that. So you can imagine how traumatic it was for this young man and his movie, right? When he came to me, of course, you know, I'm thinking, oh, here we go, right? You know, well, what am I going to do with this? You know? I'll tell you what I'm doing. I'm going to tell the truth. God heals everything. But if he's got a subluxation, there's pressure on the brainstem, all he can do is help. We just got to get that pressure off there to allow the body to heal itself. Tonight he stood. He stood tonight. Okay, now that's not me here. I'm not trying to do a revival thing here. I'm just common sense. He stood tonight. When I first corrected him, the first time in a year that he came able not to have to use a catheter to go to the bathroom. I mean, that's the power of the organ. What I do is so much more powerful, so much more amazing than any type of pain or back problem you could ever have. What we do is we're reconnecting with the maker. We're reconnecting with the power that made you. You know, the problem is in society we have more faith in a spoonful of medicine than we do the power that animates the universe. We need to rethink our thinking. Okay? We're working with people all the time that have criminal cancer. When I treat his cancer, no, I correct the subluxation. 8 weeks later, back to the oncologist, he's gone. You think I told him don't go back to the oncologist? Heck no, go back to your oncologist. You think I told this guy don't go back to your neurologist? Heck no, go back to your neurologist. Let's work together. Let's just figure this thing out together. So that's kind of what I do in a nutshell, is we work with that. We work with that. We're hand in hand with God every day, which is fun. And the cool thing is I'm my own boss, so I can talk about God. No one's going to fire me. I can have a Bible in my front room, and I'm very much that way. I also chose something, I think is one of the reasons why you brought me here, was I chose to run a cash practice. I don't accept insurance. I will not be a part of it. I will not be a part of any governmental agency deciding what I should and should not do for you. You are not a dollar bill to me. I love every one of my patients when you come in. I don't even handle the money. My office manager does. I put together my doctor's recommendation, which is my plan of care, which is truly a recommendation is honestly our best guess. I mean, what we've done, we've taken all our school, we've seen your case history, we've done an exam on you, and we think, okay, this is what I think we can do for you. And that's really what it is. It's our best guess. That's the truth of it. And so what I do is I give a recommendation. Okay, this is what I think it's going to take to get so-and-so better, and this is what it's going to cost them, and simply will present that. But I tell them this is what my plans are. Because when you come in, if I start looking at you as this dollar bill, that'll change the way I look at you, what I care for you. I just not interested in that. And I definitely don't want a guy in a cubicle telling me how many visits you should have or how much you're worth. That's just not, that doesn't work for me. So I stepped out of that arena. Now I was told when I graduated, Scott, first thing, you don't want to practice as barber. There are too many chiropractors. Number two, Scott, you can't not accept insurance. You'll fail. You know, Scott, you can't specialize in upper cervical. Nobody's going to understand it or get it. You know, everybody's telling me no. But I pray, and when I'm guided by Heavenly Father, that overrides every man's decision. So I just follow what He asked me to do to stay in this area and serve the people. And we have seen great success. As a cash practice, I have the freedom to barter with people. If some people can't afford their care, Cynthia will come back to me and we'll talk about it. We'll put together what we call, financial hardships or even bartering services. I don't mind bartering. I think that's a great way to do things. I don't mind sharing because it gets expensive. And I understand it does. I have 5 children. 5. I didn't have them by myself. I have a beautiful wife named Cynthia who is stuck with me. She's also my office manager. We have 5 children. Ashley's our oldest, 20. Then there's Kayla, who's 18. We're both in college. Ashley's going to be a chef at the dock, like me. Kayla's going to be a chef. Then I got Stefano, who's a senior in high school. He wants to go on a mission when we graduate, so he's just going to go out for 2 years and serve the Lord. Then there's Monte, who's going to be a sophomore this year, and then Anthony's an 8th grader. So pray for me. I have a lot of teenagers in that. But this is really what we are and what we do. And if I can help you in any way or answer your questions, did I cover what you wanted me to cover? I didn't. I can't help but just talk about my passion. And I know you wanted me to talk a little more political things. I just, this whole thing is going to implode. Everybody knows it. I work with other physicians a lot. I work with specialists in the fields of neurology, and they all know what's coming to. They tell me about it. They know we're being prepped for it. It's going to implode. If you're paying for any type of insurance, it should be emergency insurance, not healthcare insurance. Healthcare insurance is a lie. It's a falsehood. It doesn't really work. Take power. Everything you ever needed, you were born with. God gave you everything. That was the greatest promise you ever had. Just empower yourself. That way you